Hello, my name is Heather Barlow, and I am a USF student in the College of Nursing, and today we are going to talk about urinary tract infections and how they affect women in the military. This presentation will be directed towards physicians and healthcare providers downrange with these service members as they are at the front line of care. Women have played a role in every U.S. conflict since the American Revolution. Today, there are over 200,000 women serving in the military. This is about 14% of all service members. But even though there have been women serving in the military for decades, there have been adjustments to housing, resources, and facilities downrange that have not been made to accommodate their needs. There are times during deployment when there are no latrines available and no good bushes to go behind, and no one wants to squat in front of a group of fellow service members. Women are capable of performing the same job as men, but we as healthcare providers need to be conscious of their unique needs for health and hygiene. This brings us to the issue of urinary tract infections. A urinary tract infection, or UTI, is an infection of any part of the urinary tract. This includes the bladder, kidneys, ureters, and urethra. Women are already at greater risk for contracting a UTI as they have a shorter urethra, which is closer to the anus. We as healthcare providers need to know the symptoms of urinary tract infections and educate women on the symptoms so that they can be quickly resolved. Symptoms of a urinary tract infection include cloudy or bloody urine, pain or burning feeling during urination, urine that has a foul or strong odor, frequent need to void, cramping or pressure in the lower abdomen that can also be felt in the back, and some people may experience a low-grade fever. The causes of a UTI include avoiding urinating, dehydration, poor hygiene, and remaining stationary for long periods of time. This is particularly an issue for women in our armed forces. Although many downrange bases have separate bathrooms and trailers for both men and women, there can sometimes only be latrines or wilderness available. If there is a base with multiple units all using the same bathrooms, they can become soiled very quickly, making holding it in much more appealing than entering. With so many people flooding the bathrooms at the same times daily, such as early morning before PT, there could be none available to go to when needed. This could lead to skipping showering and hygiene, as well as skipping voiding altogether. Then, when a unit goes out to perform surveillance or other tasks on a convoy, there are not a whole bunch of places to say, "Hey, let's pull over so I can use the restroom behind that bush." Frequently, women will not drink at all during the day so that they will not have to use the restroom in front of their fellow soldiers. This can put them at risk for dehydration and urinary tract infections. So, let's say a woman has gotten a UTI. Maybe she hasn't realized that it is a UTI, or she doesn't know where to go. Or maybe there are only male physicians and she is uncomfortable discussing the issue. This issue does not get resolved, resulting in complications. These complications could include kidney stones, such as the ones seen on the screen, acute or chronic kidney infections such as pyelonephritis, or the woman could be subject to recurrent UTIs. Prevention is key. Urinary tract infections are very uncomfortable and very preventable. First, we need to encourage women to void when necessary. Don't hold it in. The UTI is not worth it. Provide small screens for women so that they can place it in front of themselves when they are out on a convoy so that they have privacy and are more likely to use the wilderness. Also ensure that the bathrooms are clean and that there are plenty of them. Educating women prior to deployment will help them to keep their lady parts clean. This means cleaning with unscented soaps and providing sanitary wipes in convoys and in the bathrooms. Teach them to wipe from front to back, not back to front, and encourage them to drink. Okay, Maybe not that much. Just 9 cups a day. That's about 2.2 liters of water. And really, that's not a lot. Thank you for watching, and let's work to keep our service women healthy.